Welcome to Transitioning to Medicare Part 2. We met last week and got to talk through the overall enrollment, et cetera. This week, we're going to focus specifically on some of the items we talked about last week. I'm Lois Romeo, and I'm part of the SHIP office. Again, in case any of you didn't hear Part 1, SHIP is local help with Medicare, no cost, confidential, unbiased. We have one full-time coordinator of the program, and that's Nicole Renewal. The rest of us are volunteers. We are trained and have to take tests to show that we know what we're talking about. We can do a lot of different things for you. We can do education. We can do one-on-one counseling. You need to set that up by appointment. We can also look at benefit program review. So if you're trying to compare a retiree program versus Medicare, et cetera, we can do that with you. We can also help you apply for financial assistance and look at problem resolution. It is available to all Carroll County residents. If you happen to have a friend who would like this same kind of help, this just gives you the phone numbers for the other counties. You could pass it along to them if they're trying to track down their local SHIP office. So what are we going to talk about today? We're going to talk about the gaps in Medicare. We're going to talk about Medigap coverage. We're going to also talk about some other ways you can supplement Medicare, as well as Medicare Advantage and health plans, Medicare savings programs. So those are the financial assistance types of programs. And again, we'll talk a little bit about healthcare fraud and abuse. So we're going to start on the left-hand side of this chart. As a reminder, in case you weren't here for the Part 1, you can be on the left-hand side of this chart or you can be on the right-hand side of this chart. You can't cross over between the two. So we're first going to talk to Original Medicare. As a reminder, under Original Medicare, if you are admitted to the hospital and you have just Original Medicare, you're going to be responsible for $1,484 before Medicare covers any of the costs of the hospital. After that, you're going to have 60 days worth of hospitalization. It does not have to be 60 days in a row. It could be 10 days in, 10 days out, 10 days in, 10 days out, that kind of thing. If you, within a benefit period, have used your 60 days of hospitalization, then you would start paying a co-insurance for the next 30 days. And if you need more than that, once in your lifetime, you can start chipping away towards your once in a lifetime 60 lifetime reserve days, they're called. So you could use that across multiple benefit periods, but you only get those 60 lifetime reserve days once in your lifetime. After that, within a benefit period, you would be responsible for all the costs if you have no other coverage. So if you are in the hospital for at least 3 full days, not the day you get discharged, but if you're in there for 3 full days and needed to go to a rehab center, if you went to that skilled nursing facility, then you would have coverage for those first 20 days. And after that, again, you start paying a co-insurance for the next 80 days. So let's talk about a couple things I just said to you. So first off, the definition of a benefit period says the last time that you either got out of the hospital or that skilled nursing facility, if 60 calendar days have gone by and you're now that 61st day, you start a new benefit period. So what that's saying is you could have multiple benefit periods within a calendar year. So you would start the cycle all over again. You'd be responsible for the 1484 again, and you would start your day count all over again in that situation. So let's give an example. January, you go in for 10 days and come out. You go back in February for 10 days and come out. Go back in March for 10 days and come out. You're still in that same benefit period because there have not been more than 60 days between hospitalizations. On the other hand, if you went in for 10 days in January and you came out and didn't go back in again until April, So now more than 60 days have gone by since you last got out of that hospitalization. You are in a whole new benefit period. So as you can see, this could add up pretty quickly. One of the drivers for people to look at Medigaps. The other thing to be aware of is if you are outpatient surgery, for instance, and or if you are in the emergency room, even if they end up taking you to a room, you are still not admitted to that hospital. After 24 hours of emergency room, they might move you to a hospital, another place in the hospital, but they are required to tell you after 24 hours whether you are under observation or whether you've actually been admitted. If they don't give that to you, you need to ask for it, because it's your 3 days of hospitalization to be able to qualify for a rehab center are dependent on the admission, not on when you were under observation. So unlike Part A, medical insurance, Part B, so again, that's your labs, your x-rays, your doctors, durable medical equipment, cancer treatments, et cetera. All that falls under Part B. For Part B, that does run on an annual basis. So within a year, first off, you're going to pay, for most people, you're going to pay a standard premium, the $148.50 per month. That's going to come right out of your Social Security check if you're taking that. And secondly, if you are not yet taking Social Security, you will get a quarterly bill for 3 times that amount. That may also be income adjusted if you make more than certain amounts. The first $203 that you spend in the year on medical and things such as doctors, you will be responsible for. That's your Part B deductible. After that, Medicare is going to pay 80%. Beneficiary is responsible for 20%, unless you go to a doctor or facility that does not accept assignment. There may be an additional 15% charge above what Medicare allows. So to make that clear, a doctor or facility that does not accept assignments has not agreed to the rate that Medicare has set. They still have to be tied to that rate, but they can charge up to 15% more. So if you go to a doctor and they charge $200 and the Medicare rate is $100, if they accept assignment, Medicare is paying $80, you're paying $20 that you're responsible for. If they don't accept assignment, then they could be getting paid $115. And in that situation, Medicare is going to pay the $80, again, 80% of their rate, the $100. You're responsible not only for the $20, but you're responsible for that extra $15 that doctor or facility is charging you. So a lot of people avoid that by just checking up front whether they accept assignment or not. So what do your out-of-pocket costs look like with original Medicare? Well, first off, that depends totally on the type and frequency of healthcare you need. Because if you're not going to the hospital, you aren't paying those co-insurances, et cetera. It depends on whether your doctors or facilities accept assignment. That was the rate that Medicare set. And it depends on whether you have other healthcare coverage. So that health insurance coverage could come in multiple flavors, but it depends on that. So what's a Medigap policy? These are, you'll hear them called secondary, you'll hear them called Medigap, you'll hear them called Medicare Supplement insurance policies. First off, these are sold by private companies. So they get to set various information like their rates for the table. They get reviewed, but they're able to set that based on the claims that they've paid out. They put their case in front of the Maryland Insurance Administration. They are designed to fill the gaps in original Medicare. To not be confusing, that is not gaps. So if your Medicare, if it's not a service covered by Medicare, your Medigap is not going to cover the differential, the deductibles for co-insurance. However, if it is something that's paid by Medicare, And you, depending on the plan you pick, it will pick up those deductibles and or the co-insurances. They are standardized plans. So when you're going to look at the information for these plans, you're going to see all different costs for your premium. And that's because they pay out different amounts of claims, et cetera. However, any plan that has the same letter has the same coverage. So don't look at that cost and say, oh, that's a little higher each month, they must cover more. No, that's not the answer. They still have to cover the same things. So one of the decisions in determining whether this is the right thing for you to look at and pick is, it is a way that you might be able to lower your out-of-pocket costs. When you're thinking about it, think about a 30-year horizon. So you may be very healthy today, but say your family history says you might be not so healthy 10 years from now. And or you can have surprises, whether that's a car accident or, being diagnosed with ALS. There are a lot of different things that can come up with surprises over the next 30 years. But you're trying to take your best view of what you think you're likely to look like over the next 30 years. So with the Medigap policies, you're going to have a monthly premium payment. You may only get a Medigap policy with original Medicare, Parts A and B. So if you pick a Medicare Advantage plan, you may not pick up a Medigap policy. People who need a Medigap or may need to get a Medigap, they're not going to need one if they have certain other health insurance. So many people with employer retiree plans, federal health benefits, state of Maryland, so states, counties, any kind of government programs, TRICARE, VA, Medicaid, COBRA, folks with that kind of coverage typically may not need a Medigap because you've already got something that's supplementing your original Medicare. But let's say you don't fall in one of those categories. Then you may want to consider a Medigap. And there are different plan types. So if you go down the left-hand side of this chart under benefits, you'll see a list of the things we had on the earlier pages. So the deductibles and co-insurances. If you go across the chart and look down the columns, those are the Medigap plan types that you can pick. Most commonly chosen for many people is a Plan G or a Plan N. We could talk about any others when you come in to see us, et cetera, but this is just to give you an overlay. So Plan G, you'll see if you look down the column, has an X in every single box except the $203 Part B deductible. That's because none of the plans, if you did not turn 65 before January 1 of 2020, you are not able to pick a plan that covers that $203 deductible. So you'll see it's blank. There's no X in any of the columns. So outside of that, if you pick a Plan G, it's going to be the highest premiums, but it also is going to give you full coverage. So you'd pay the first $203 and all your other co-insurances or deductibles with no upper limit will be covered by your Medigap, which may, by the way, be different than some of your employer coverages where they have an upper limit of spend. A Plan N will be less expensive premium than a Plan G. You're still going to pay that first $203. But what's different from a G is when you go to a doctor or facility, you're going to pay up to $20 for that visit. And if you go to the emergency room and you're not admitted, you'll pay up to $50. If you're admitted, you don't pay that amount. The other thing you will be responsible for if you pick up a Plan N would be if you go to someone who does not accept assignment. If they charge that excess 15%, you would be responsible for that. Your Medigap is not going to cover that for you. So G and N are two of the more commonly chosen ones. We're beginning to see more people even pick the G high deductible. So let me explain how that one works. You'll see the footnotes down below in the box. On a G high deductible, you're still going to pay that $203, your first Part B deductible costs. You also, for any services you use, you're going to pay your portion of that, whether that's the $14.84 or the 20%. You're going to pay that up to an amount of $23.70 in addition to the $203 before your policy is going to cover anything. So it's a much lower premium. It's really designed more for being catastrophic coverage for you. So what that says is, in any given year, or like in 221, you would pay the $25.73 if you use that amount of services. But you also know you're covered completely after that for everything but drug we're talking about. So this is your hospital and your medical. So for folks who are pretty healthy and don't end up in hospitals a lot, and therefore might not spend anywhere near that amount of deductible in a given year, they may save quite a bit of money doing it this way. But it also usually assumes you've got some money sitting in a 401k or a 403b that if you do meet those circumstances, then you have the money set aside to be able to pay for them. So that's another one that more people are considering than we used to see. So how do you determine what the right Medigap policy for you is? You can go out either to www.medicare.gov or the insurance administration from Maryland government. I would recommend, if you go out to look at this online, going to the Maryland Insurance Administration site. And the reason being, they have the annual premium. So you'll be able to see what any given policy is going to cost you. For many people, it's easier to actually look at the Spiral book. It's online out at that Maryland insurance site. But we also can send you, or you can stop by and pick up a printed version of that, because some people like to look through it and make notes, etc. So that's a good resource for that. So who can buy a Medigap? First off, you have to have both Part A and Part B. All of these things, and that's true for everything in Medicare, these are individual policies. Sometimes you're used to family coverage, that kind of thing. Each spouse would have to buy a separate policy. Some of the companies you'll see listed out there in the footnotes in particular will have some spousal or household discounts if more than one person is with that company on those policies. So what's medical underwriting all about? That's really determining your health status and medical history. So during open enrollment, so your own personal open enrollment, not the annual one, you have something called guaranteed issue rights. And that says they cannot do medical underwriting. They cannot ask you health questions other than whether you smoke or not. So when's the best time to buy a Medigap? It's really during your Medigap open enrollment period of guaranteed issue rights. The other thing that happens in guaranteed issue rights is if you pick a policy, they have to give it to you. You could apply anytime in your life for a Medigap, but you will not have guaranteed issue rights. And that's true for two things. You're normally going to have a higher premium because they'll look at any medical issues. And secondly, they don't have to give you a policy. So if you ever want to switch down the line, make sure have not gotten rid of the old one until you have the new one lined up. So your open enrollment for Medigap is the 6 months beginning when you are 65 or older and you've enrolled in Part B. This is one of the big reasons people delay enrolling in Part B until they're no longer covered by active employment coverage. It's also for people who are on disability the first 6 months that you're under 65 and have Part B. But there's only two plan types you can pick, A or D, and they are much more expensive. But once you're 65, you are eligible for a second Medigap open enrollment period. And you definitely want to do that because you have guaranteed issue rights again for 6 months, and that means they can't do medical underwriting. So you look like every other 65-year-old coming into a Medigap, and therefore your rates will be much lower than they are under the Plan A and D. So this is a little bit of repetition of what I've already mentioned, but if you go at any time after your Medigap, your personal Medigap open enrollment period, then they can require and usually will require medical underwriting, and you can be turned down or charged more. So don't cancel that current policy until you know you have a new one. There are a few times where you can get some additional guaranteed issue rates, and that's for 63 days. And that's really if you have original Medicare and employer group coverage health plan. If it pays after Medicare, which is your companies that are 20 people and under, and that plan is ending. So that would give you a 63-day guaranteed issue right period. If you have a Medicare Advantage plan that is ending, so if it's not offered the next year in our county, for instance, you have a 63-day period to pick a Medigap with guaranteed issue rights. If you either joined a Medicare Advantage plan when you were first eligible at 65 and you wanted to switch back to original Medicare within that first year, or if you dropped a Medigap policy to join a Medicare Advantage plan for the first time, then you have that plan less than a year and want to switch back, you in both of those situations also have a 63-day guaranteed issue rights. This is not something you can flip back and forth. This happens one time, but it is a chance for you to try a Medicare Advantage plan and then, switch back to original if you're not happy with it. So the link below that's listed here will give you the rules around those guaranteed issue rights. But this is also Choosing a Medigap Policy. It's a book I highly recommend for you to review if you haven't, because everything we're talking about will be in much more detail in there. And it's a good refresher if you get confused. And it'll help you figure out the questions you want to ask if you call the Medigap company to get enrolled. The things that can be different. So they have to cover the same services. If they're a G, they cover the same medical services as every other G plan. You can ask them, though, questions like, what do you do that's above and beyond? That won't be a medical coverage, but it could be something like a 24/7 nursing service, or it could be a situation where they give you money towards a gym membership, that kind of thing. So, those are things that, again, you'd want to review that book to help you make sure you're asking the right questions. The Medigaps also have something called Medigap rating. So there are 3 types. There's issue age rated, attained age rated, and community rated. Issue age rated says that it is based on the age you purchased that. And, men and women will have different policies, but let's say you're a woman and you go in at age 65 and I go in at age 75, my rate is always going to be higher than your rate. So your premiums can still increase, but they're not based on age. There's only one company that does issue age across the board. We'll show you some examples here in a minute. One company in the state of Maryland. The great majority you're going to see are attained age rated. That that premium is automatically going to go up as you get older. It might be on an annual cycle, might be on a 3-year cycle, might be on a 5-year cycle. But it will go up as you get older. A community rated, and again, there's only one of those in the state of Maryland. Everybody pays the same premium for the same policy. And that should actually read, all females are grouped into one grouping, all men are grouped into one grouping. So that can work to your advantage or disadvantage. So in all 3 of these, the Maryland Insurance Administration, when they review each of these companies each year, they may grant an across-the-board increase. And that would be due to those companies having to pay out more claims than expected. But, they're still held to a certain level of profit, et cetera. The other way they can go up is dependent on which of these 3 types of plans you pick. So it could go either direction. So I'm going to give you a couple examples. So there's only, first off, for format wise, this is a page pulled from the book, and it's also the information you would find online that you can look at, and every one of the companies listed, it'll have the name and how to get in touch with them on the left-hand side. It's not showing on this particular one, but this is the only community rated plan offered. They have a different, because of the community rated, you'll see a table for the female non-tobacco and a table for the male non-tobacco. The base rate, if you're going in under guaranteed issue rights, is the rate you would pay. That is, you'll see it's higher as you go up tier 1 and 2, which deal with health related things. So under a cycle that you would go in that's not guaranteed issue rights. But you can see when you see the rates on these, you need to make sure in these charts that you look at the footnotes. So a couple things. In the big print at the bottom, you'll see that if 2 or more have at least one eligible plan issued under group master policy, then you each would get, even though you each have to have your own policy, you'd each get a 5% discount on that. The other thing that's important to note here is that if you're coming in certain cycles, so if you go in on your 65th birthday or your Medicare Part B effective date, if that's later than 65, then you're eligible for an early enrollment discount program. So if you went in at 65 through 68, you're going to have a 39% discount off of the rates you see there. If you do the math and apply that, that means you're paying 61% of that cost. And that makes it then very competitive with other rates you'll see in the table. If you just look at this flat rate, you're going to say, what? Anyway, after that, what they do is they don't take you up because of age, but your price will go up 3% each year up to the age of 81. And then this is your rate, whatever their current rate is there. So that rate could be higher because of across the board rate increases, but you're not going to go up just because you got older. So people who expect to live a long time, have good health, this could conceivably work to their advantage. But that's one of the things that book will help you sort of sort your way through. Here's an example. And again, there's only one that has issue age. And that issue age, again, if you went in at a younger age than I did as a female, then you will have a lower rate across the table. So you'll see different rates in here, but that's because you might come in at a different age. So again, you can go up, but you're not going to automatically go up because you got older. And then this is what you will see for many of them. Again, during guaranteed issue rights, you're going to be looking at the male preferred or female preferred or base rates. And this one has a 7% household discount, for instance. But as you can see, if you went in as a male at 65, your rate would be $153 right now. By the time you're 85, it's up to $262. And a high G, this is where you'll see why this looks attractive to some people. You're paying almost $93 less at age 65, and you're paying actually almost $60 less at age 85. So you'll see the rates are much cheaper, and that's great in a year you don't use a lot of costs. You might make up that difference in a year you do use a lot, right? A lot of services. And then you can see what a plan N looks like. So that goes from 109 to 198. So again, and by the way, it'll keep going up after 85. They just show you through age 85. So how much does a Medigap cost you? It's going to depend on your age, which company you buy a policy from, the type of policy you purchase. So that would be your issue age, et cetera. Your health, if it's not during guaranteed issue right period, and the letter you select. So again, we can send you can look online, you can pick up the annual premiums booklet, and that comes out in January and July of each year. So this is a very important decision because you're going to kind of usually make this, as a lifetime decision, only because you're not typically going to want to buy outside of a guaranteed issue right period. So you want to make sure you're comparing the companies and their costs, pick the policy that suits you the best, and then you would contact that insurance company, fill out an application. They'll mail it back to you, you sign it, or they can do some of it electronically, all online now, and you can buy the Medigap policy. As long as you keep paying your premium, you have that policy. So we cannot call those companies for you. We can enroll you in Medicare Advantage plans and in drug plans, but not in the Medigap plans. So there are multiple ways you can do that enrollment. You can go to the plan's website, you can call the plan, or you can call us for detailed assistance. We won't enroll you in it, but we can answer any questions you might have about it. So that's Original Medicare. Again, a reason a lot of people pick it is because they know they're going to pay the $148.50 in most cases for their Part B premium. They're going to pay whatever the premium is on the Medigap plan they choose, and they'll know what deductibles or co-insurances they might have to pay for, which may be just the 203, right? And then we can always run for you each year a Part D prescription drug plan. So, little quick refresher, the parts you have to get to not have penalties would be, you'll get Part A, Part B can have a penalty, Part D can have a penalty if you don't sign up, when you're eligible and aren't still actively covered, right? Part D, we recommend you look at every year. And now we're going to switch over to Medicare Advantage plans. Again, private companies, we do recommend you look at those every year. So, footnote at the bottom, you'll see, if you pick a Medicare Advantage plan, you may not get a Medigap. That's not legal. In a Medicare Advantage plan, you're going to be picking either an HMO or a PPO, or there's something called an MSA that also falls under this category that we'll talk about. This will include Part A and B, and usually Part D. So what you do know over on this side of the equation is that you are going to still pay your Part B premium, that $148.50 a month, and you will have then a premium associated with that Part C. This will be an HMO or PPO, so it will be regionally based. So if you spend half your year outside the state of Maryland or on the road or whatever, this may or may not be, the best plan for you, because under Original Medicare, you can go to any doctor or facility in the US that treats Medicare, which is almost all of them. If you pick a Medicare Advantage plan, you still have to be treated for emergency or urgent care, but you have a regional set of doctors and facilities. So with the HMO, if you go outside that network, you will pay all the costs. You have no coverage. If you join a PPO and go outside that network, you are going to pay a higher amount, either a percentage or a set fee, but you have coverage. The reason that people lean more towards the right-hand side would be if they can't afford a Medigap, so therefore they have unlimited, conceivably, outside of pocket spending. Because over under these plans, you have an out-of-pocket limit, which we'll talk about in a minute. You also can get, depending on the plan and possibly with additional premium, you can get some coverage for standard checkups and things like that for your glasses. So for your vision, dental, and some pretty good coverage for hearing aids. So these plans are an alternative way of getting your Medicare benefits. You're still in a Medicare program, so you get all the Part A and B services. So they're still run by the guidelines associated with Medicare. You still have benefit periods, all of those sets of things. But if you have an Advantage plan, you may not get a Medigap plan. So these are run by private companies. You're going to do cost sharing. So you're going to pay those monthly premiums and co-payments or co-insurance for services. You do, however, have out-of-pocket limits for the year, and there will be geographic limits. And you may, and in most cases, will use a network of providers, and many of them require a referral to see a specialist. So there are extra services you may be able to get that you can't get under original Medicare, such as vision, dental, and hearing. And prescription drug coverage may be included in all but one of our plans. It is included, all but two, actually. So when can you enroll in a Medicare Advantage plan? Initial enrollment period. So when you're first eligible for Medicare, each year you can review your coverage because these run on an annual basis. And that's during the annual enrollment period. That's October 15th through December 7th. There's some special enrollment periods. And it really is important to review it every year just to make sure you understand anything that's changing, et cetera. These are the plans that are available in Carroll County. This can vary by county. As you can see, we have HMOs, PPOs, and then the MSA plan, which I'll talk about. The number 5, the Care First plan, that is only available for people who are full benefit, dual eligible, or QIMBY, which means essentially you are at a Medicaid type level. So this is a busy chart. I'm not going to go through all the squares on it, but it's a chart that I put together literally just to help us be able to explain some of this to you and for us to review it in the office with you if you think you want to consider a Medicare Advantage plan. So I'm going to go down to one of the more commonly chosen ones. Let me explain a few of the terminology on here. So if it says in, that means it's in-network cost. If it says out, it's out of network. You'll see places where there's a 0 for deductible. You'll also see that if you're out of network on some, you're going to pay 100%. And that's because it's an HMO and you have no coverage. In the first column, the monthly premium, you'll see that there's an H and a D. That's just saying, for instance, on the Care First, you're paying $35 for your monthly premium. 20 of that is your health coverage, and $15 of that is your drug. The reason we split that out for you is if you have certain financial assistance, then either a portion or in the Speed App program, up to $50 a month against your drug premium will get paid. So that's why we split it out. Other than that, you don't need to really know that split. So I'm going to go down to Johns Hopkins Advantage PPO, not because I'm recommending it, but it's just one of the ones more commonly chosen. So if you chose an Advantage PPO and did not have any financial assistance, you would pay $91 a month for your plan coverage. That's in addition to the $148.50 you're paying for Part B. You would have, in your drug side of things, you could pay up to $350 deductible for it. This is where your maximum out-of-pocket comes into play. So if you were in the hospital multiple times, et cetera, and you ended up incurring enough co-pays and co-insurances to hit $7,550 in that calendar year and stay totally in network, then after that, everything except drugs will be fully covered. So that's what we mean by maximum out-of-pocket limit. If you had both in and out of network services done that year, you would actually have to hit $11,300 to hit your maximum out-of-pocket. But after that, you have, again, that catastrophic coverage. So let's look at just a couple of the elements. So if you were admitted to the hospital in that particular plan, you still have benefit periods, but it's structured a little differently. You would pay $310 for each day if you're in network. You would pay $310 for each day you're in the hospital up through day 6. So let's say you were in there for 6 days. You're going to pay $1,860. And then you actually have coverage for 90 days of hospitalization. If you were to go to an out-of-network hospital and be admitted, then you're paying 30% of the cost. If you go to your primary care physician, you're going to pay $10 per visit. Every time you go to a specialist, you're going to pay $50 per visit as your co-insurance, co-payment. And then if you were to go out of network to either one of those, then you're going to pay 50% of the cost. So this is just to show you what some of your other fees might look like. You'll notice emergency and urgent, there's set fees on those or set amounts, right? And that's whether it's HMO or PPO, because everyone is required to treat you in an emergency or urgent situation. Again, if you go down to the Hopkins Advantage PPO, this just gives you what some of those copays would be. So if you had an MRI, you're going to pay $250 if you go in network, $250, and 50% of the cost if you went out of network. You'll see in some cases, like standard lab work, you're not going to pay anything for that if you're in network. And out of that, you're going to pay 50%. So again, these are just to give you an overall flavor of what your costs would look like, since every plan is different. But if you decide you really want to investigate further and you go online, we can give you all the detail behind that, the descriptions and individual fees and all of that. There's also something called a medical savings account. And this is fairly new. And honestly, I don't think any of us have dealt with anyone who's chosen this yet. But it could be, if you've got money in the bank, in savings, et cetera, this might be attractive to you. I'm going to flip down to, you're not able to join one of these if you have an employer union retire plan, TRICARE, VA, federal benefits, hospice care, or if you're eligible for Medicaid. In those situations, you can't even make the choice of picking one of these. But if you did pick one of these, it's basically a high deductible insurance plan. So think of it as somewhat set up like an HSA, if you've ever had one of those. You're still going to pay your Part B premium. Any money you don't use in a given year gets accumulated across years. So you can actually, bank some more money. So the plan is going to put an annual deposit for your use on health expenses into an account for you that's set up specifically for this. The providers are required to charge you no more than your Medicare approved amount we talked about earlier. So just to show you the two plans, if you pick the first plan there, what's going to happen is that plan, that MSA, is going to put $2,000 into an account for you. You may use that across, and you get to spend that across that $2,000. And you could spend that for multiple things you wouldn't necessarily normally have coverage for, because you can use it for different types of health expenses. After that $2,000, you would be paying out of pocket, outside of that account for the next $3,000 worth of medical expenses you had. And then once you've met that annual deductible of $5,000, so the combination of the annual deposit and your responsibility, then you would have full coverage for all costs other than, again, prescription drug is outside of this. So if you pick an MSA, you could accumulate across these. If you don't see much medical coverage or medical expenses, this might be one that's worth considering for you. And then if you pick an MSA, in this situation, you do need to pick a drug plan unless you have some other credible coverage for a drug plan. Okay, so you should be setting up a My Medicare account out at www.medicare.gov. And that's where you can look at all your information associated with this. If you have any trouble setting one up, we can always help you do that. And if you do set one up, then you're always going to go in and log in. Once you've created an account, that's how you're going to log into My Medicare. That will allow you to do things like do your drug comparison each year, or look for providers, or, learning more about Medicare. So for instance, all the books we recommend are out there online, and you can do all these sets of things out there. If you don't like a lot of paperwork, which I don't, I get all mine electronically. So those Medicare summary notices that can be very bulky, I'm able to look out there and review them. I don't have to have them printed out, so I'm not, wasting paper or printing by the government or myself. These are things to consider when looking at Medicare Advantage versus original Medicare. If after you review this, you have questions, then I would recommend setting up an appointment to come on in and see us or calling Central Medicare. So there's a lot of information sources for your Medigaps and health plans. Maryland Insurance Administration, you can call them. You can go online and look at it. You could go to Central Medicare for finding both Part C's and D's in your area. It's going to ask you for your zip code. You can come to us and we can help you with this, or you can call Central Medicare. And those are your phone numbers that you would use if you do that. So a lot of different sources out there to help you. We understand this is confusing. We don't mind repeating ourselves. Please come see us. We'd rather you go through it multiple times and feel comfortable with your choices than make a decision that's not a good decision for you. So the next question is, do you qualify for a Medicare savings program? So the first three on this chart, the first three rows are federal assistance. For any of the federal assistance programs, you will have both an income limit and an asset test. You can see it's different if you're individual or if you're married. It's looking at your gross income. So if you have a pension and Social Security and get some rental on a rental property, all of those would have to factor into your income to compare against this. An asset test would be things like you have in savings. It doesn't include your home, your car, your burial plot. But if you have a secondary home, then yes, that would get counted into the assets. If you have a 401k or any type of IRA like that, those would be counted as assets for you. When they're sitting in those funds, it's an asset. Any money you have distributed from that each year would then be counted into your income limit on that side of the equation, just the distribution. So if you qualify for QIMBY, so you meet both the income limit and the asset test, then you're going to be, things are being paid very similar to Medicaid. It's going to pay for most of your costs. If you qualify for SLIMB, which you'll see has a little higher income limit and a little higher asset test, I'm sorry, the asset test is the same, then it's not going to pay for your other cost sharing kinds of things, but it will pay that $148.50 a month, the Part B premium. If you qualify for either QIMBY or SLIMB, you automatically qualify for Social Security Extra Help. If you look at the income limits and the asset test, you may also qualify for that even if you did not qualify for QIMBY and SLIMB. Extra Help is whereas QIMBY and SLIMB are designed to help you on the hospital and medical side of things. Extra Help is designed to help you on the drug side of things. So your prescription premiums, your deductibles, and copays. So if you qualify for any of if you believe you qualify for any of those, you can contact us and we can help you fill out the applications you would need for that. And Social Security Extra Help, you can actually apply for right online at the Social Security site. There is one benefit that we have quite a few people on in Carroll County called the Senior Prescription Drug Assistance Program. You'll hear us talk about SpeedApp. That's what this is. The reason so many more people qualify for that is, as you can see, the income and asset levels the income levels are much higher. There is no asset test on this particular benefit. For each of you, that would pay up to $50 towards monthly premium. So if you're a couple and you qualify, because if one qualifies, the other will, It could pay up to $50 for each of you towards a monthly drug premium. It also would allow you during the year to make one extra switch to the drug plan that you're on. So, that can be very helpful if all of a sudden you get prescribed a very expensive drug that's not on the formulary of the plan you're on. So again, we can help you fill out any applications for these. So that's the high-level view of the Medigap and Medicare Advantage plans. This is really back to, we want to be able to prevent fraud. And unfortunately, the people trying to commit it just keep getting smarter and smarter. So we fix one problem and something else shows up. The last data I had, although I'm sure this is outdated by now and hopefully it's improved, but the last data I had said we had lost $60 billion a year because of Medicare fraud and abuse. You're the first line of defense against that. So first off, do take care of your Medicare card and number. Treat it like it's a credit card. Watch out for identity theft. Don't leave it laying around. Don't be handing it out to people. Don't give it out. If somebody calls you or comes to your door trying to, do the next level view of something for Medicare for you, they will not do that from Medicare. So you can start with the assumption it's a fraud. Medicare will not call you unless you've initiated and said you're willing for them to call you back. So just assume it's a fraud if somebody calls you up and starts trying to sell you something and says, and what's your Medicare number? Don't give it out. You should only be giving it to your doctor or other Medicare provider. If you come to see us or you talk to Medicare, the central number, then, they would have to have your Medicare number to be able to look you up. But other than that, you should not be giving it out. So in detecting the Medicare fraud and abuse, the best way to do that is for each of you to review your Medicare summary notices. That's the report you'll get that shows all the services that Medicare has paid for on your behalf. And it'll also show you if something gets denied to be paid for because it's not a covered service. But it'll show everything that's been billed to Medicare. So we need you to review that and see if anything doesn't look right to you. Are there things on there that you didn't have done? Did something get billed twice? Were there things on there that you, as far as you know, your doctor has never ordered and you've never then received? If you suspect that there might be Medicare fraud and abuse, then you need to report it. But you can first call the provider, because a lot of times it will be somebody just typed a number in wrong. If that doesn't appear to fix the issue and get it taken care of, then you should make sure you have your information at hand and you can contact your SMP, your Senior Medicare Patrol. That can be either Central Medicare or it could be us at the SHIP office because we're also SMP. It's free and it's confidential. So we can look at it with you. We can then interact with Central Medicare to get this reviewed to determine whether it's fraud and abuse. And this is, like I said, a confidential service. Your name will not be, you won't be called out on this by someone. So again, we're the SHIP and the SMP office. We're designed to be helpful for you and do it in a non-prejudiced manner because you don't pay for anything. We don't get any money associated with you picking different plans, etc. If you want to set up an appointment with us, you can call one of two numbers. You can either call 410-386-3800 or 410-386-3806. In both cases, the people that would answer are able to help you set up an appointment. Nicole Renewal is the one-time, the only full-time employee in the SHIP office for Carroll County. And she is the person who then manages the whole program. The rest of us are volunteers. She or the front desk will set up any appointments you have to meet with any of us. It is free local help. We're here to serve you. We don't mind repeating, so please reach out. The other thing, you may have questions, and that would be a really good time to pick up the phone and call and set up an appointment with us. Maybe able to help you over the phone. You can also, questions might be that you want certain of the publications and things like that. We can either put them aside for you to come pick up from us, or we can mail them out to you, either one, or you can get them online. This is just the income-related Medicare adjustment amount. So this was the point that I said some of you might pay more than the $148.50 a month. If you are making these higher amounts, then you could pay, all the way up to $504.90 for your monthly premium for Part B. Most people fall in the $148.50 range, but as you can see, it is a graduated up. It also is based on your yearly income from 2 years prior. In Part D, that adjustment, again, you'll see the dollar amounts that you would have to make for it to be a higher premium. But in this case, what you do is you pay the plan premium by whatever plan you've picked, and then you would add the amount in the right-hand column to it, up to a possibility of $77.10. So we appreciate your time and interest. Look forward to talking to you. And thank you very much for joining us.